The perineal nerve.
Anatomy and palpation. The perineal nerve can be palpated along its length, in particular on the dorsum of the foot, and lateral to the knee where it wraps around the head of the fibula. The nerve can also be palpated posterior to the knee, where it lies medial to the lateral hamstring. Extension of the knee will tighten the nerve a little more, as will plantar flexion of the foot. Therapist assessment, plantar flexion inversion, straight leg raise. Here I'm taking Claire's foot and plantar flexing it, inverting it, holding the foot still, and with my arm along the shaft of her tibia performing a straight leg raise. This will challenge the entire perineal net. For the more mobile person, the plantar flexion inversion straight leg raise can be performed via the shoulder. Here I have Claire's leg on my shoulder and I'm walking up towards her. Passive techniques. In hip flexion, lateral rotation, plantar flexion inversion, I'm going to do a spinal lateral flexion. Take the hip up into flexion. Explore the rotations, either medial or lateral. Extend the knee. Now plantar flex and invert the foot. And then now I'm going to ask Claire to laterally flex her spine and head. Structural differentiation can be performed by neck flexion, and any of these movements could be used as part of therapy. Passive techniques. In hip flexion, I'm going to do a plantar flexion inversion technique while I extend the knee. This may be useful for a settling sprained ankle. This technique will mobilize both the perineal and the tibial tracts. Passive techniques. In slump long sit, plantar flexion inversion, I'm going to mobilize Claire's superior tib fib joint. The foot is held in plantar flexion inversion. Now I'm grasping the superior tib fib joint and mobilizing it while I'm extending the knee. To place more load on the neural system, I can ask Claire to flex her neck at the same time. Self-management, some gentler techniques. In hip flexion, plantar flexion inversion, Claire is simply extending her knee. This may be appropriate for an acute ankle injury. The same technique can be performed as a slider. Note here, while the knee is extended, Claire is extending her head. This allows a distraction, and it also provides a very neurally non-aggressive movement. Self-management, gentler movements. The leg swing with the toes curled under. This is a gentle mobilization of the perineal system, and it also provides a little balance challenge as well. Self-management, stronger movements. In slump long sit, Claire is now holding her foot in plantar flexion inversion and extending her knee at the same time. This is quite a strong challenge on the perineal system, even more so if she flexes her head at the same time. This technique could be adapted to the tibial or sural nerves. Here is the slider technique. Note Claire's neck is being extended while she extends her knee. Self-management, stronger movements. A standing mobilization for the perineal nerve. Claire's right knee is held into extension by her left leg. The foot's in plantar flexion inversion. The hip is in adduction, and she's simply flexing forward. Self-management, stronger movements. A wall mobilization. Using a towel or strap, the foot can be held in plantar flexion inversion, and then the knee is extended using a wall. Of course, you could take this further by adding the neck flexion or extension. Self-management, stronger movements, a hamstring stretch with a focus on the perineal nerve. Note in this position, the foot's in plantar flexion inversion, the hip's in medial rotation, and Claire is flexing her spine as well. So a technique which is aimed at the hamstring can be focused on the perineal nerve.